Dr. Drummond, he's joined us here throughout the years, and we've had the pleasure of meeting several of his patients.
Some of them dealing with headaches, fibromyalgia, low back pain. Another common issue that we've heard a lot about is neck pain.
Oh, yeah, a lot about that. Dr. Drummond takes kind of a more holistic approach to treatment. He's with the Spinal Balance Health Center. Good to see you, Doctor.
Nice to have you here.
Thanks. Good to be here
What is
again.
it about this neck pain? You know, I've had problems with my neck in the past, but neck pain, and so many people have problems with it. What is it?
I think the main problem with neck pain is that nobody's treating the underlying problem. If something hurts, we take an Advil or something of that nature. But the neck is kind of an interesting area. As we move around and our head bobbles from side to side, our neck has to constantly adapt to that, and that's perfectly normal. But when you're in a locked imbalance posture and you're forcing your neck to have to adapt in the same way all of the time, then that wears the neck out. And then the atlas is a little bone at the top of the neck that will become misaligned and interfere with posture. That's what we correct. But on the right-hand side, you can see this individual, the top of their neck would be positioned correctly where the nerves controlling posture are causing the back muscles to pull nice and evenly on the framework and everything's balanced. But on the left side shows what happens when the top of the neck is not aligned properly. And that bone being out of place will interfere with the back muscles, causing one side to tighten more than the other.
It looks like a curvature in that
It
spine.
is, yeah. And if the most important part is if you look down at the bottom, there's a short leg on the right-hand side. So if you're standing on a short leg, somewhere along the line, you've got to adapt to get back upright with gravity. And the low back and the neck are the two main areas that will do this. You're totally adapting. So you're in what we call a poor adaptive posture. And that puts stress in the neck all the time as you walk through the day, day after day after day.
Well, you brought in a bowling ball, Dr. Drew Drummond.
Is that your bowling ball?
That is my bowling ball. I used to bowl. I met my wife bowling.
Did you
Oh,
really?
that's awesome.
Yeah, back when I was in my 20s.
But that's not why you brought it in, was to tell us the story of how you two met.
Yeah.
So
No, it
what's the
wasn't.
demo?
So this is, I don't know, I hope this translates well on TV land, but if you think of this as the head and this is the neck, as long as it's upright and balanced, it might move a little off center to the left or to the right. Let me move this out of the way. To the left or to the right, and I make little tiny small adjustments, but it's not too hard to keep balanced. But if I start moving it to the side, I have to input more and more and more force in the opposite direction to keep it from falling over. And if I go the other way, then I have to pull it the other direction. And it's the same with the head. If your head is leaning off to one side, the muscles on the side of your neck opposite the way you're leaning have to constantly contract to pull you back up. And if you're always locked in that same imbalanced posture and your muscles are constantly having to work, for every inch your head goes off its center, it increases the apparent weight of your head by 10 pounds. Or 10 times the stress on your muscles.
Oh my gosh.
So for the people we brought in here with neck pain that it gets better right after we adjust them, it's because we take them from an imbalanced posture to a balanced posture. And so when we adjust the atlas and get the nervous system functioning better and get posture being controlled better, it's just like moving that bowling ball back up to center. Immediately my arm does not have to work as hard.
I talk about this holistic approach to what you do to help with this neck and back pain. Is that a correct assumption? It's kind of a holistic approach?
If you could separate things into two categories, holistic and allopathic or symptomatic. And so if you have a symptom and you just want to get rid of it, you can do some very easy things to get rid of pain, maybe a muscle relaxer, an Advil, some stretching, things like that. But if you want to get to some of the underlying problems, that's more of a holistic approach. And in the case of what we're talking about here, there's an original misalignment to the top of the neck that can throw the posture off and lead into this and many other symptoms. So when you're dealing with problems from more of the causal standpoint than just a symptomatic standpoint, I lump that into more of a holistic view of healthcare, and that's what we're doing.
People might wonder if I'm already in pain. I don't want to go through more pain in treatment. Nuka Care is pretty darn gentle, isn't it?
Yeah, absolutely painless. I've had people come in with years and years and years of muscle pain. It's like one side of their neck is tight, and we do a gentle adjustment like being shown here on the monitor, and right when they stand up, they're actually out of pain. They don't go through pain to get out of pain. If there's anything that's painful, it's when I get a person that's been locked in a poor, imbalanced posture for decades, and we get a really great correction, painless, but a great correction, and they completely straighten up, and their muscles will just be sore throughout their whole body.
Right, only because they're now where they should have been the whole time, but their muscles were fighting, and it creates that soreness. Yeah.
Right, but we're talking about the neck here, but it's not just neck pain that you treat, because the neck, I guess there's all sorts of factors that go into the spinal cord.
Yeah, it's so hard to focus in 7 minutes. It's hard for us to focus on everything that happens throughout the body, so I kind of picked the low back one time to talk about, and then the neck, and then how it affects headaches. But when the atlas is out of place, and it causes a nervous system stress throughout the whole body and postural stress through the whole body. It's limitless what can happen as far as symptoms go.
How do you know if you're a candidate for care?
I usually just need to look at a person's posture. Ultimately, it's an x-ray that I have to look at.
Yeah.
You can see me analyzing one here and measuring the relationship of the head with the top bone of the neck with the rest of the neck. But usually, before we even get to that point, I can just look at somebody and I can identify, for example, that short leg that was on that first diagram. If that leg's pulled up, most of the time that's a physiological leg length difference. It's because of muscles.
They got to get in and see, and you're making it easy for our viewers to come in and see.
Absolutely.
You brought in a special offer, and you do this from time to time. A lot of times you bring in this. So it's the first 15 people who call your office, Dr. Drummond's office, are going to receive a consultation, exam, and x-rays, and this is all for only $50. If you've had x-rays before, you know that $50 is a bargain.
It's just to drop that money barrier in between people that need to get checked and that want to get checked.
Well, and people who are curious about it and think, I don't know, I've tried other things. Could this work? It makes it so you can go in and find out for sure. Spinal Balance Health Center, they're here in Omaha. Online at spinalbalancehc.com. But if you want to take advantage of that special offer, that whole bundle for just $50, call right now. It's 402-452-3400.
All right, Dr. Drummond, thanks for coming in.
Thanks for having me. It's always a pleasure.
Thanks for bringing your bowling ball in.
I need to use it more.
Yeah, right.
Love it. Thank you.
All right, so what